Welcome back, everybody. Joining me now live on the News 4 Forum is Dr. Dopf, Medical Director at St. Mary's Hospice. Thanks so much for being with us, Doctor. I really appreciate it. Today we're talking about something that a lot of people have probably heard of but may not be very familiar with, and that is hospice. Tell us, what is hospice?
In patients that have a life-limiting illness with a life expectancy of 6 months or less, hospice is the type of care that we bring about that really focuses on the quality of life, the patient comfort, often excuse me, maintenance of their home environment, support for families, treatment very aggressively of symptoms rather than the disease process itself. So hospice brings all of that to families and patients, most often in their homes.
Tell us a little bit about why someone should use this service and maybe when as well.
There's a trend in traditional medicine to continue with very aggressive means of cure right up until the very end of somebody's life. And more often than not, on the order of almost 90% in this country, patients will die of a terminal illness, often in the hospital, surrounded by strangers with a number of really not indicated interventions. And what hospice does is seek to make the last months of someone's life comfortable and peaceful and dignified. And somebody should choose that because it is the standard of care for meeting the needs of a dying patient.
And as somebody who had a family member in hospice, it's also extremely important for the family as well. Tell us a little bit, how does hospice contribute to quality of life?
I think by maintaining somebody's independence and their comfortable surroundings as the primary goal, by looking at some of those really not focused on elements in traditional medical care like the spiritual component, the environmental components with getting life affairs in order and the assistance of a social worker to do that, addressing the symptoms that go along with the dying process, whether they be pain or non-pain related, making that the focus of medical treatments, and really just kind of focusing on those elements that are identified by the patient and the family as the most important to them, rather than eradicating disease.
Dr. Dopf, thank you so much. First, for what you and your staff do, very important to a lot of people and help them in a really tough time. And thank you for being with us this morning. Really appreciate it. All right, coming up next, Jen Wall joins us with a look at our snow. We've got more on the way, but wind, it's rough out there. Stay with us, The Forum. We'll be right back.